I'm routinely asked about the risk of recurrence of breast cancer, the risk of the recurrence of in situ breast cancer, risk of recurrence of invasive breast cancer. And I thought I'd share again an overview on this subject. Now remember, I've shared before that breast cancer is a galaxy of diseases, from things way over on the benign side and not very aggressive at all to things way over to the very, very aggressive. So what are the chances of a in situ breast cancer, a DCIS, coming back? Well, it's a lot of the same answer. And the answer is it depends on a multitude of factors. The factors that it depends on are the grade of the in situ breast cancer. Low-grade breast cancer has a much lower chance of coming back over the patient's lifetime than, let's say, a higher grade breast cancer. DCIS that is occurring in younger patients has a greater chance of coming back than in older patients, let's say patients age of 70 or older, as an example. Other factors go into the markers of the in situ breast cancer. Typically, the estrogen and progesterone receptor. DCIS cancers have a lower risk of coming back, where the HER2 neu positive may have a higher risk of coming back. The age of the patient, the size of the cancer originally. A tiny, small area of a centimeter or so or two, properly treated. And the caveat here is that obviously a patient's having proper treatment, then the chance of those smaller cancers coming back is less than the larger cancers coming back. My colleague Mel Silverstein developed the Van Nuys criteria, which you can search on the internet, and gives a variety of variables that look into the odds of DCIS coming back, including the factors that I'm sharing with you, as well as how much tissue or the margin of normal tissue around the site of the surgery. If a patient has a lumpectomy versus a mastectomy, the good news with the lumpectomy is you get to keep your breast, but you need some radiation therapy usually. The bad news is the cancer can come back because the breast is there. If a patient's DCIS is treated with a mastectomy, then the odds of it coming back at the original mastectomy site are extraordinarily low. So it's a difficult question to ask. I've recently shared with you that one of the real breakthroughs in dealing with this whole issue is now the application of the Oncotype DX analysis specifically for DCIS, and looking at a low risk of DCIS versus high risk and the benefits of radiation therapy. As I said a minute ago, we want to do radiation therapy often with DCIS, but frankly, there are many patients who have lumpectomies that don't need a radiation therapy if they have a low recurrence score with the Oncotype assay for DCIS. In general, what I quote to patients is roughly 0.5 to 0.7, maybe up to 1% chance per year of the DCIS returning. This assumes, of course, the full galaxy of proper treatment, proper surgery, radiation therapy if it's needed, anti-estrogen therapy if it's needed, and the work done hopefully by a multidisciplinary team. I hope you find this further overview helpful to you. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.